Welcome to the Ambetter from Magnolia Health Podcast, where we bring you information on Ambetter health insurance and give you tools you can use to build a healthier life. Ambetter is health insurance available on the health insurance marketplace. I'm your host, Becky Martin with Ambetter from Magnolia Health. This episode is your guide to the basics on how to shop for a health insurance plan on the health insurance marketplace. The federal government operates the health insurance marketplace. It's also known as the exchange, the marketplace, and healthcare.gov. And you can shop for a plan the following ways. Through a certified insurance partner's website, and that would be Ambetter. You can go to enroll.ambetterhealth.com, and it will take you right to the enrollment platform. You can contact an appointed health insurance broker. Now, this is my personal favorite. It's free to talk to one of our brokers, and you can find one by going to ambetter.magnoliahealthplan.com. Click on Our Health Plans and select Find a Broker. Then you just enter your zip code to get the contact information for a broker near you. And finally, by phone. Our Ambetter Member Services call center reps in Mississippi can connect you with an insurance broker if you call 877-687-1187, relay 711. No matter how you shop, you'll need to provide some basic household information. Here's a checklist to help you get prepared. Have social security numbers or other ID numbers available for anyone in your house applying for coverage. Income information. This may be tax statements, pay stubs, or W-2 forms. And be sure to have this information for anyone in your house applying for coverage. Current health insurance policy numbers. If there are members of your family who already have health insurance coverage, you'll need to provide those policy numbers as well. Employee coverage form. The employee coverage form is a government form that you'll need to fill out if you currently have the option to get coverage through your employer or your spouse's employer. You can find this form on healthcare.gov. Now that you know which websites you can access to shop for health insurance on the health insurance marketplace and the basic information you'll need to have with you, it's time to call in one of our top Ambetter brokers for expert advice. Earlier, I called Ambetter broker Kenneth Bell with Bell & Associates consulting firm in Tupelo, Mississippi. I asked him to explain what people can expect when they enroll online through enroll.ambetterhealth.com.
Thanks, Becky. Before we talk about what people who are new to the marketplace can expect, let me give some advice to those who are renewing Ambetter plans. Even if you like the insurance you had in 2020, it's worth your time to log onto your Ambetter member portal and review those options before you automatically renew. Sometimes plans change. Either the premium goes up or your doctor may not be in network or the prescriptions you might need might not be covered. So we want to make sure that doesn't happen to you. It doesn't happen a lot, but you'll want to know in advance so you don't get surprised later. Things change for members as well. Your income may change or your household size. These are things that you should report to healthcare.gov when those things happen. If you haven't, now's the time to do that.
Let's walk through the enrollment steps for those who are shopping the health insurance marketplace for the first time. Since this is the Ambetter from Magnolia Health Podcast, I'm going to tell you how to enroll through enroll.ambetterhealth.com. First, you'll enter your zip code. Entering your name, email, and phone are strictly optional. Then you'll click on See Plans and Pricing. The next screen asks for your age and your gender. And if you claim your spouse or dependent on your income taxes, you'll need to enter the same information for them. After you give your age and gender, it asks if you're a tobacco user, if you're pregnant or eligible for coverage through Medicaid, CHIP, Medicare, or your employer. Let me tell you why. If you check that you use tobacco, you may pay a little more for your premium, but if you don't report it and you end up with a tobacco-related illness, you could be denied coverage. Now, if you're pregnant, you can't be denied coverage, and you may qualify for financial assistance. Plus, you'll see free pregnancy-related services on each plan the search engine finds for you. Finally, if you qualify for Medicaid, CHIP, or Medicare, you won't qualify to shop on the marketplace. And if what you pay for your employer-based insurance is more than 9.78% of your income, you should not check that box and you can continue shopping. The next screen you see asks for household information. the number of people you claim on your income tax, and what your annual income is. If you're not sure what counts as income, there's an income calculator you can use. It lists what you and your spouse can claim as income, such as tips, self-employment income, Social Security, unemployment, and more. It also tells you what you shouldn't claim as income, like child support, gifts, or loans. After you list your income, the platform will give you an estimate of what you'll save if you qualify for a subsidy. Before I go any further, I asked Kenneth Bell to define the words subsidy and cost-sharing reductions.
A subsidy is an advance premium tax credit. It's a tax credit you can take in advance to lower your monthly health insurance payment or your health insurance premium. When you apply for coverage through the health insurance marketplace, you estimate your expected income for the year. If you qualify for a premium tax credit based on your estimate, you can use any amount of that credit in advance to lower those premiums. If at the end of the year you've taken more premium tax credit in advance than you do on your final income, you have to pay that excess back on your federal tax return. If you're taking less than you qualify for, you get that back as far as the difference. A cost share reduction is a discount that lowers the amount you have to pay for deductibles, your co-payments, and co-insurance. If you qualify for these, you can only use them if you enroll in a silver plan, which is an Ambetter balanced care plan.
After you see your estimate of what you'll save or your cost savings, you can click Continue, and the prompt will ask you how much health care you expect to use in 2021. For a single person, low means no doctor visits, no labs, and 1 prescription. Medium means 1 doctor visit, 1 lab, and 9 prescriptions. Or high, which means 3 doctor visits, 3 lab visits, and 27 prescriptions a year. Remember, on the health insurance marketplace, preventive services like immunizations and annual wellness screenings are provided to you at no cost. The next screen asks if you have a doctor or hospital you prefer. You can skip this, but if you fill in the blanks, you'll be able to see if your doctor or hospital accepts the plan. Based on all the answers you provided, the website first shows you the plan with the best estimated affordability. You can view the plan description to see the sticker price, which is based on the national average of service costs for people with demographics similar to yours, as well as estimates of what the insurance pays and what you will pay. After you review this plan, you can click on Enroll in this plan or click on the Compare All Plans button, and that will let you look at other plans the site has found and compare them. I asked Kenneth Bell to tell us about the difference between the metal tiers or plan levels that will populate depending on the zip code you entered and the carriers available in your area.
First, let me say this, that a bronze plan or Ambetter Essential Care plan is not a lesser plan, meaning that you don't get less coverage than a silver plan, which is an Ambetter Balanced Care plan, or a gold plan, which is an Ambetter Secure Care plan. A bronze plan typically gives you lower monthly premium payments, but potentially higher out-of-pocket costs if you end up needing a lot of care. And a gold plan may have higher monthly premiums, but help you limit your out-of-pocket costs later. If you're looking for a balance on your monthly premium payments and your out-of-pocket costs, silver plans provide just that. And silver plans are the only plans with those additional out-of-pocket payment reductions, cost share reductions that I mentioned earlier. This helps lower your costs on your co-pays, deductibles, and even your co-insurance. So if you're eligible for a subsidy and cost sharing, silver plans offer the highest value.
As you scroll through the list of plans, there are checkboxes next to the word Compare in each plan description. Once you select those boxes, you can click on the Compare banner and a table populates so you can review each plan side by side. Once you've decided on a plan that suits your budget and your needs, you will click on the Enroll in the Plan button. This is where you'll complete your personal information that wasn't collected on the previous screens. Kenneth Bell had these words of wisdom to share with us before we end the show.
Just make sure you don't wait until December 15th, which is the very last day to enroll in the health insurance marketplace plan. And when you sit down to review those plans, carve out at least an hour and have all your information organized before you start shopping.
And before I go, this is the perfect time to remind everyone that it will make the enrollment process so much easier if you ask one of our brokers to help you. It is completely free to speak with one of our Ambetter brokers. They will walk you through the entire enrollment process. Kenneth Bell with Bell & Associates Consulting Firm enrolls people across the state of Mississippi. His number is 662-260-4635. You can also go to ambetter.magnoliahealthplan.com and click on Our Health Plans. Then go to Find a Broker and you can look Kenneth Bell up, or simply enter your zip code to find a licensed broker who lives near you. Thank you for joining us for the Ambetter from Magnolia Health Podcast. You can find this episode on our website, ambetter.magnoliahealthplan.com. Remember to like Magnolia Health on Facebook and subscribe to Magnolia Health on YouTube to check for details on the next podcast. Ambetter from Magnolia is underwritten by Ambetter of Magnolia, Inc., which is a qualified health plan insurer in the Mississippi health insurance marketplace. Ambetter of Magnolia, Inc. complies with applicable federal civil rights laws and does not discriminate on the basis of race, color, national origin, age, disability, or sex. This is a solicitation for insurance. Copyright 2020, Ambetter of Magnolia, Inc., all rights reserved.